A 22 years old lady presented with symptom and sign of the hyperparathyroidism, and her diagnostic workup resulted in a diagnosis of the Graves' disease. Which of this statement best describes the pathophysiology of this condition? So Graves' disease, it is a form of the hyperthyroidism. It is the option here the options: formation of IgG antibody against TSH receptor, formation of IgG antibody to TRH receptor, formation of IgM against TSH receptor, formation of IgA to the TSH receptor, formation of IgM antibody to TRH receptor. So what is the actual pathology? So in Graves' disease, the Graves' disease patient develop IgG antibody. This is the IgG antibody, that means it is the longer duration against the TSH receptor on the thyroid gland. So what is Graves' disease? It occurs due to IgG antibody formation against the TSH receptor, and it is chronic and long-term stimulation of the thyroid gland and release of the thyroid hormone that result in raised thyroid hormone, that means the T3 and T4, and decreased level of the thyroid stimulating hormone. Thyroid receptor autoantibodies should be checked in individual present with hyperparathyroidism because it present about 85% of the cases. This is the normal feedback mechanism that the thyroid releasing hormone releases from the hypothalamus and acts on the pituitary, releasing of the thyroid stimulating hormone, which acts on the thyroid stimulating receptor on the thyroid gland, and finally formation of the T3 and T4. So it is the normal mechanism. So when there is the against TSH receptor, there is formation of the IgG antibody. It continuously influence the thyroid gland and release more level of the T3 and T4. When more level of the T3 and T4, it goes feedback mechanism, and finally the TSH level reduces. But this TSH receptor is not responsive to the TSHs because it acts like autonomous and it increases T3 and T4. So it is the formation of IgG antibody against the TSH receptor on the thyroid gland. It is true. Other options such as the IgG, but it is TRH receptor, which is not true. IgM, IgA and IgM, they are not produced in this condition.